Good afternoon, everyone, and welcome to our webcast about the UMP Plus UW Medicine Accountable Care Network option. I'm Tina Mankowski with UW Medicine Accountable Care Network. We're looking forward to telling you more about UMP Plus and the UW Medicine Accountable Care Network. On the phone today are several colleagues from the Healthcare Authority, UW Medicine, and Regents who can share information to help address your questions. From the Healthcare Authority, we have Martin Thies and Janice Kuntz. We also have Melissa Vasiliadis from the UW Medicine Contact Center. We're going to hand things over to our colleagues at HCA to get started with a few housekeeping details and an overview of UMP Plus. Marty, can you take this?
Yes, thank you, Tina. This is Marty Thies at the Healthcare Authority. I'm an account manager, and I'll be kicking things off today before we learn more about UW Medicine Accountable Care Network directly from Tina. First, a couple of technical details. You can access sound through your computer, or you can use your phone. The number, access code, and audio pin can be found near the bottom of the audio panel. If you have questions you'd like to ask about UMP Plus or the UW Medicine Accountable Care Network, use the questions section on your panel to submit them in writing. We'll try to get to all of the questions during the latter part of the hour. This webinar is being recorded and will be available for viewing within a couple of days after broadcast. Okay, we'll begin with a quick overview of the UMP Plus Health Plan. We'll highlight the UW Medicine Accountable Care Network and what it includes. And we'll also discuss how to ensure your provider is in-network, how to enroll, followed by a Q&A period to finish out the hour. So I'll ask the question, what is UMP Plus? The Healthcare Authority manages a number of insurance options for the state's public employees. The Uniform Medical Plan, known as UMP, is the state's self-insured health plan for public employees. The UMP Medical Administrator is Regents Blue Shield. If you're familiar with UMP Classic, this was the original self-insured plan, and it remains popular for its broad provider network. UMP Plus joined the UMP slate of plan options in 2016. There are similarities between UMP Plus and UMP Classic. Like UMP Classic, UMP Plus is an offering of the Uniform Medical Plan administered by Regents. In addition, all the providers who participate in the UMP Plus networks are part of the Regents network. And like UMP Classic, UMP Plus enrollees can also self-refer to specialists. So what's the difference? We'll start with lower monthly premiums and annual deductibles. And just a note here regarding monthly premiums, there may be some variation between different employer groups. If you're unsure, check with your personnel, payroll, or benefits office. But in addition to monthly premiums and the medical deductible, subscribers receive all network primary care visits without any out-of-pocket expenses. And there is no annual deductible for drug coverage. Another significant difference is a consistent focus on coordination and quality. Known as Accountable Care Networks, or ACNs, the two UMP Plus networks are geographical groups of providers dedicated to working together on behalf of plan members. As a plan, UMP Plus was designed to provide public employees with healthcare services through networks of providers who choose to work together to improve care. And they agree to be held accountable to standards for the quality of the care they provide. The providers who participate in the UMP Plus plan are, in turn, dedicated to preventive health care, consistent engagement with patients, and improving health outcomes. Tina from the UW Medicine Accountable Care Network will elaborate on this idea in a moment. So why should you enroll in UMP Plus? First, you have access to this dedicated network of providers and specialists who work as a team to improve health services and outcomes for enrollees. Second, you have access, and if you're changing from UMP Classic, you retain access to the Regents network of non-primary care providers. For example, you can access chiropractors, massage and physical therapists, and acupuncturists, just like a member does in the UMP Classic plan, and with the same fees. Also, when you travel and have an urgent medical need, you have the same access as in Classic to the International Regents Blue Shield network. But a note here that only emergency or urgent care are covered at the network rate outside the U.S. Most notably, and once again, many find the UMP Plus premiums and contributions to be extremely enticing. This table is a comparison of the monthly premiums for UMP Classic and UMP Plus for each of the 4 categories, working from the left, a sole subscriber, a subscriber and spouse, a subscriber and children, and a full family. Which is your category? At the bottom of each column is how much you'll save annually in monthly premiums alone. For example, at the bottom of the column to the far right of the table, in bold, is the annual savings for a full family when UMP Plus premiums are compared to those in UMP Classic, a savings of nearly $1,900 just in premiums. Here are a few more figures comparing the 2 plans. You'll notice that the medical deductibles in UMP Plus are half what they are in Classic. And also that UMP Plus has no prescription deductible and no out-of-pocket for in-network primary care visits. So who is eligible for UMP Plus? UMP Plus is currently offered in a total of 8 counties in 2019, as listed here. You also must be an employee, a person with continuing coverage, a retiree with no one on the account enrolled in Medicare Part A or B, or a COBRA member also with no one on the account enrolled in Medicare Part A or B. Here's a map showing where UMP Plus is available for 2018. UMP Plus is the fastest growing UMP plan offering. It grew by over 40% last year. Starting at an enrollment of about 10,000 in its first year, 2016, UMP Plus enrollment has now, in contrast to this slide, has now exceeded 27,000, indicating consistent member satisfaction with the plan. We anticipate much more growth as members experience the benefits of UMP Plus. Now, who might not be a good candidate for UMP Plus? UMP Plus would likely not work for persons living outside of the UMP Plus counties. For instance, if there is an out-of-state college student in the family, or if anyone on the account spends portions of the year overseas or, say, in Arizona. For them, UMP Plus as a geographical network might not be the best fit. So, with that general information about UMP Plus, I'll turn it over to Tina, who will tell you more about the UW Medicine Accountable Care Network. Tina?
Thank you, Marty. Not advancing. Okay, whoops, we advanced too far. Hold on, please. Get us back. All right, I think some of the information on this slide you've heard already, but I think some of the most important things for you to note as you make your decision is that there's lower monthly premiums for you and your family free office visits to network primary care providers. And although those are free office visits for your primary care provider, if you need an x-ray or some lab work done, there still is a cost involved with that, but the visits themselves are free. We've talked about the affordable annual deductible and no annual deductible for prescription drugs. And for UMP Plus members who subscribe to the UW Medicine Accountable Care Network, we have a free virtual care clinic and a 24/7 nurse care line. And we'll talk a little bit more about that as we go through the slides here, but I think those are going to be very important considerations for you to make. Okay. Oops. So when it comes to accountable care, I think experience really matters. We launched our first accountable care network in 2014. We were one of the first products for the Boeing organization, and we've been with them ever since. And the HCA joined us a year afterwards. So we have a great deal of experience in managing individuals in the accountable care network. We have one of the most comprehensive networks in the Puget Sound region. I think sometimes we hear about accountable care networks as being narrow networks, but for us, it's not a narrow network. These are some of the partners that we have in our network. They are all like-minded organizations who want to deliver quality health care at an affordable price. So we have Capital Medical Center, Island Hospital, Multicare, and we'll show you on the next slide. Excuse me, sorry, we've just missed something here. Okay, sorry, I'm having a hard time advancing this. So this just shows you the Accountable Care Network members throughout the Puget Sound region. And you will note the ones at UW Medicine, but we also have Multicare, Overlake Hospital, Capital Medical Center, Seattle Children's, Seattle Cancer Care Alliance. I think these are very important considerations for you to make for some of these specialty care that can be provided in these hospitals. There's some new things for 2019. Island Hospital and their associated clinics have joined the Accountable Care Network, and we have additional providers and clinics throughout our network. This year, however, Grays Harbor County has been excluded from our network, and that includes Grays Harbor Community Hospital and their associated clinics, as well as Eastside Family Medicine. So you can see across the Puget Sound region that we have primary care, specialty care, clinics, urgent care centers in a variety of locations throughout the counties that Marty talked about. While we're talking a lot about primary care and the low cost of primary care visits, I think it's also very important to point out the most advanced complex and specialty care that we provide throughout our Accountable Care Network. Anything from cardiac care to autism to the neurosciences area, women's health. These are all very important considerations when you're looking for a system to affiliate with. I'm going to talk a little bit about ancillary services. And these are services that are in support of the medical care that you will be receiving. These include anesthesiologists, chiropractors if you need dialysis, laboratory testing. We have a number of ancillary services that are included with UW Medicine. However, there are a number of ancillary services that are not part of the UW Medicine Accountable Care Network that are still provided through UMP. That are still provided. So if you are in need of any of those services, it would be really great for you to take a look at our, go to our website and click into ancillary care and see the types of services that are provided either through the UW Medicine Accountable Care Network or through Regions. And as I just mentioned, the Regions Blue Shield Network providers are located on our website, or you can also go to the HCA website and take a look at those providers through that. So we really have a patient and family-centered approach to the care that we provide. Our goal is to keep you healthy. Wellness and prevention services are really key to having a good and healthy experience in our Accountable Care Network. We also are very adept at coordinating chronic conditions that someone might have. So if someone has diabetes, and a heart condition, we have navigators who can really help make sure that you stay on point, that you get to your appointments, and that you receive the care and any kind of services that you need. We also provide easy access to your online medical records. We have fast appointment scheduling, in many cases for primary care at same day or next day appointments. We also offer quick access to specialty care. And although you don't need a primary care physician to refer you for specialty care, we really think that it's important to have a primary care physician. They can act as your advocate and really help you connect to that specialty care that you might need. We also have walk-in care available at 60-plus urgent care clinics throughout our system, and easy online access to appointments. Many of our primary care physicians are offering online appointment scheduling. The other piece that I think is really important for you to consider is our ACN virtual clinic, and this is free to anyone who selects the UW-Medicine Accountable Care Network. And you can access healthcare from the comfort of your home or office via phone, tablet, or computer. There's no cost to any UMP Plus UW-Medicine ACN employees. You will reach a board-certified physician or nurse practitioner who can provide you with an array of home care support options, suggest over-the-counter treatments, arrange a prescription, and help find a convenient pharmacy. This is available 24 hours a day, 7 days a week. And for any of you who have small children, I think this is a godsend. You can access care at any time, and you don't have to bundle up the little one and get in the car. We also have a centralized contact center, and you can see on the top of the slide here the phone number for that. This is especially for UW-Medicine ACN enrollees. They can help you make an appointment with network providers or receive assistance or help you with any referrals. They can find network clinic locations and hours, find out if a provider is in network, connect you with the virtual care clinic, or connect you with the 24/7 nurse care line or other services as needed. Excuse me. The 24/7 nurse line is available free of charge to you as well, and they can help you with a variety of problems and issues that you might be experiencing. They also have access to your medical records. Contact center is open Monday through Saturday, 7 a.m. to 7 p.m. However, when you call the number, you can gain access to the nurse care line by pressing the number that they indicate. We have a dedicated website, and it provides you information on the benefits of joining the UW-Medicine ACN. It provides you with information on each one of the healthcare organizations in our network. Each one has what I'd like to call a card that walks through the type of care they provide, any of their centers of excellence that they have, and any kind of specialty services they have. I think that's really valuable information. There's an FAQ. You can research our network providers, clinic locations. There's links to the ancillary provider search and link to the virtual clinic. So it's pretty much one-stop shopping at our website. And this is just a screenshot of the website, which I hope that you will all take a look at. Some of the things you can do is search for providers. And if you're considering our ACN, I would highly recommend that you go onto the website and search to see if your primary care providers and any specialty care providers that you're currently using are a part of the system. And here's for clinic and hospital locations. And note, too, that you can search for ancillary providers if there's at the region site. And now I'm going to hand it back over to Marty to talk to you about how easy it is to sign up for the UW-Medicine Accountable Care Network.
Thanks, Tina. Signing up for UMP Plus is fairly simple. I'll run through the online process for doing so, but a couple of notes first. If you are a UW or UW-Medicine employee, you will need to sign up using Workday. Second, you can always go to your payroll or benefits office for assistance. Just as easy and maybe a little faster, you can go to the PEBB webpage that brings you here. Page down to select your member type. The choices to click are in blue. They are public employee, retiree, or continuous coverage. And then click on My Account, the green pill you see in the upper right. That will bring you to this page. Log in with your email address and password. There is a forgot email and forgot password option at the bottom of the page if you get stuck. And once you've signed in, the system knows who you are. This is the page you'll come to. It will list the details of your current plan. They aren't shown here. This is where you start if you want to change your plan during open enrollment every November. And to do so, you go to the bottom of this page where you'll see the green button labeled Review or Change Your 2019 Enrollment, and that's the one you click. This is where you can select your network. Note that this screenshot depicts the UMP Plus premium, $50, for a single subscriber. You'll see the premiums reflective of your current account, whether single, with a spouse, and so forth. Signing up for the 2019 plan year, your choices are the UW Medicine Accountable Care Network or the Puget Sound High Value Network. After you've made your selection, be sure to click the green Continue button at the bottom of the page. This is the page that will come up asking you if the plan change information you've entered is correct. Be sure to double check, and if it's correct, then click the green button at the bottom to confirm. Then you'll be instructed to print your confirmation page, which is a good idea. It's pretty simple, and remember, if you need assistance or have questions about how to do this, just reach out to your payroll or benefits office. Again, annual open enrollment period for the 2019 plan year began November 1st, last Thursday, and ends on November 30th. Benefits fairs are underway now, where the two networks will have tables staffed with knowledgeable people who can answer your questions. Upcoming, there's a benefits fair and a UMP Plus presentation in Kirkland from 8 to 10 a.m. on November 8th. That's tomorrow for those participating live today. And that's at Lake Washington Technical College. On November 15th, you'll have the same opportunity from 9 to 11:30 a.m. at Clover Park Technical College in Lakewood. On the 19th, from 11 a.m. to 1 p.m., there will be another benefits fair and UMP Plus presentation at the Cherbourg Building on the Capitol campus in Olympia. Contact the blue link at the bottom for more information regarding open enrollment, which ends November 30th. And at this point, I'll hand the webinar back over to Tina.
Thank you, Marty. All right. So again, if you want to learn more about the network, please visit our website. It's up on your screen there, or you can call the contact center, and Melissa and her team will be happy to answer any questions that you might have. So we have, here's just some more general information. If you want to learn more about benefits, again, the HCA website, UMP customer service, and prescription drugs is always another important number for you to have at hand, and you can talk with those entities if you have any specific questions. So we're going to take some questions now, and we have a question here from an individual about are there closed captions provided for this webinar, or will a transcript or captioned recording be made available? I'm going to send that over to you. Marty, would you be able to make a transcript available?
We can certainly look into that, and we can respond.
Okay. Another question, are all providers at UW Medicine covered in this plan? Yes, they are. But again, I always say everything with a caveat. I would definitely go online if you're looking at a specific provider and make sure that he or she is included. And if they're not and they're part of UW Medicine, please call the contact center and we can problem solve that for you and just see what might have happened. So, okay, please share what's the same or different regarding mental health coverage, including inpatient, outpatient mental health, and substance abuse disorders co-occurring coverage. Can you take that, Marty?
I'll have to ask that question here. I don't know the answer to that.
I think if you want to take a look at the certificate of coverage, we can go on to the next question. And again, if we are unable to answer your questions today, we will make sure and contact the individuals who've asked the questions and get them the answers. So, Mary, we'll get you that. We'll get you that answer. Okay, we have another one. Can you continue to purchase prescriptions at local pharmacies? Yes, you can. Okay, here's someone from Tacoma who's been on UW Medicine for 2 years. Let me read this real quickly. Okay, this is about your urgent care coverage. Yes, when you do go to urgent care, we do advise people to find a primary care physician. That is the most, that really is actually one of the best ways to get your care delivered, so you're seeing the same physician who gets to know you and helps you. So you were charged out of network, and one time you were charged in network. If you're having a specific problem with your urgent care, I would highly recommend that you contact the contact center, and they can help you problem solve why you were charged at two different rates. I really do not know why that happened, but again, they can problem solve for you.
And I can add to that, Tina. I've seen this occur before where perhaps a hospitalist comes through who is not part of the network or perhaps not a Regents provider. But that should not happen if someone comes through who is not a part of the network and bills an out-of-network, and that can be appealed. And I have seen those appeals go through just fine.
Okay. Another question here, Marty, that I think you would be best to take. What happens if my provider is not in the UMP Plus UW system, but is listed in Regents, and it says that that person accepts UMP Plus?
I am a UMP Plus member, so I do have some personal experience with this one. A lot of times when we're communicating with a provider office, we're speaking with people who they ask what is your coverage, and as long as they hear the word Regents, they assume it's under Classic, and they might not be familiar with the geographical nature of the network itself. And what I always try to do is when I'm referred to a provider, I will use the access line to my network, and I'll bring up the website for provider search, and I'll go through it with assistance from the UW network, and we will find out for ourselves. And I might have to do this 2 or 3 times a year, just to make sure from the UW network that the provider is in UMP Plus. What I'm saying is sometimes the providers aren't fully aware of all the UMP options.
Okay, thank you. Here's a question about Walgreens, if they've been added under UMP Plus. I would recommend that you call the Washington State RX Services, and that number is 1-888-361-1611, and they can advise you if Walgreens has been added. The next question is, are both ACN, the UW Medicine ACN and Puget Sound High Value Network? Puget Sound High Value Network is in Spokane County. The UW Medicine Accountable Care Network is not in Spokane County or in Yakima. Again, where to go to find out more information about a registered dietitian? Go to the website and look at the Ancillary Services, and they can provide you information on that. Yes, naturopaths can be primary care providers. That's a question about that. So we will be joining the Medicare program soon. Could we switch to UMP? No, you cannot. Yeah. Could you please restate the website where you can look at services, massage therapy, etc., covered by UMP Plus? If you go to the, you can go to the UW Medicine Accountable Care Network website, and there will be a link there that will take you to Ancillary Services, and you can take a look at that. There's a UW Urgent Care in Lacey. What's the advantage to seeing them versus another urgent care in regards to copay? Marty, do you want to take that?
We'll have to get that answer back to you.
Okay. My daughter is an out-of-state college student. I found primary care providers near her school, so why was it suggested UW Medicine is not a good option for out-of-state students? UMP Plus is not a good option. Yeah, because there's only certain counties that the UMP Plus option is available. So if you have a someone who's out of state and they're just on regular UMP, they can still be covered, but it's just the UMP Plus that doesn't cover it. If you are in Medicare, you're not. Oh, I'm a retiree. My husband has Medicare A and B. Both of us are currently in UMP Classic. Are we eligible for UMP Plus? No, you are not. What doesn't this plan cover that Classic offers? Well, so what this plan doesn't cover is if you're in our network, you're in our network. If you're in Classic UMP, you can go anywhere to receive your care, essentially. So you could be seen at, let's say, UW Medical Center, and then you might want to have a clinic appointment at Swedish Medical Center. Swedish Medical Center isn't part of our accountable care network. So that's the difference between the two plans. Here's one about ensure captions are made available. I'm very sorry that we did not do that, and that is a point well taken. We will make sure that there's closed caption available in the future. Is the provider pool smaller between UMP UW versus UMP Classic? What's the big difference between the two options that makes UMP UW less costly? And I think I just answered that earlier, is that with UMP Plus, you're in a system. We call it a quote unquote narrow system. However, it's pretty expansive. We have a lot of options for enrollees. With UMP Classic, you can go outside that narrow system.
UMP Classic, this is Marty from the Healthcare Authority. UMP Classic is what's known as a provider preferred network. All Regents providers are available to all the enrollees at the 85-15, typically 85%, 15% copay. And Tina is right. There's really not so much discrimination. You can go anywhere for your primary care so long as they're a Regents network provider. These are UW Medicine and Puget Sound High Value Network are accountable care organizations. They are a subset of the Regents provider network, and that is the primary difference. Need to be a little bit, be thinking about the providers you're seeing. But after switching from UMP Classic to UMP Plus myself, I didn't find that it was much of a problem at all, since my providers were already a part of the network.
Okay, and we have one last comment here, and that's a thank you from one of our listeners. So if there are no other questions, I'd like to thank all of you for joining us today, and please visit our website, look to see if your providers are part of UW Medicine Accountable Care Network. And,
excuse me for just a second, is that Tina? Yeah. Hey, Tina, Michael Arness here. Did you want to address the urgent care question? I just came into the room.
Oh, you came into the room. Oh, why don't you go ahead and yeah, why don't you please talk about that?
Thank you. I'm so sorry to interrupt. Let me just make sure that I'm getting the gist of the question. But yes, there's an urgent care, UW urgent care in Lacey, Washington. And so what's the advantage to seeing them versus another urgent care in regards to copay? So the good thing about urgent care is that any of the urgent care centers within the UW Medicine system, and we do urge members to do what you can to stay within the UW Medicine system. And all the other urgent care providers that are available through Regents are at the same co-insurance or copay rate. So that's a good thing to know, because every single urgent care center that is signed up through Regents automatically comes into any of the UMP Plus plans. Again, we want people to go where care is convenient, but also ask you to consider trying to stay within the network within your UW Medicine system. So thank you, Tina.
All right. Anything else? Again, thank you so much for joining us today. Thanks.